Good afternoon, and thank you for joining us for this community briefing on COVID-19 and our local response. Joining me again is interpreter Margie Propp, and thank you so much, Margie, for providing your services. And thank you to the media and to all of you who are tuning in for this information about the pandemic and how you can protect yourself, your loved ones, and our community. We want to remind everyone to visit our website at covid19.lincoln.ne.gov, where you can continue to access additional updates and resources to help navigate through these turbulent times. The website includes a data dashboard that is updated each day about the time of this briefing, and you can learn there more information about our cases and our health department's investigations of them. The website also features our COVID-19 risk dial, a simple tool designed to help everyone know what actions and behaviors that we can all take to protect our health and that of our neighbors. The COVID Risk Dial provides a visual, color-coded depiction of local conditions that we're experiencing here in Lincoln and Lancaster County. In other words, it offers essentially a forecast of risk. And because the risk of spread of COVID-19 in our community continues to be high, the dial remains at orange and comes with the following recommendations. Stay at home as much as possible, and definitely stay home if you are sick. Keep 6 feet of distance between yourself and others. For those over the age of 2, wear a face covering when outside the home, and continue to wash your hands frequently with soap and water and routinely disinfect highly touched surfaces. We begin our briefing on the numbers today once again with deep regret over the 7th Lancaster County resident who has passed away due to COVID-19. The number of lives lost statewide is now 128, and each death is a great loss for our community and our state. On behalf of our city, I extend condolences to all of those who have lost a loved one due to this disease. Here in Lincoln today, we have had an additional 21 individuals test positive for COVID-19. The total number of lab-confirmed cases in Lincoln now stands at 910. Our total recoveries identified to date remains at 120 individuals. Interim Health Director Pat Lopez is here and will now provide an update on the Lincoln-Lancaster County Health Department's investigations.
Thank you, Mayor. The number of cases related to the Smithfield Creek plant continues to grow. The total number of Lancaster County cases connected to that plant have risen from 261 yesterday to 285 as of today. 169 are employees of the plant and 116 are family members or other direct contacts. The number of positive cases related to our Lancaster County plants is also up slightly. The number of local cases related to the Smithfield plant in Lincoln is up from 17 yesterday to 20 today. That includes 15 employees and 5 close contacts. The number of local cases related to the Smart Chicken plant at Waverly is up from 12 yesterday to 15 today. That includes 8 employees and 7 close contacts. We continue to work with these facilities to provide assistance to mitigate further spread and to complete more testing. These clusters are identified through contact tracing, and we continue to work with those individual businesses or locations based on their specific situation and needs. The health department contacts affected employees and families and provides education and resources. We review the site's infection disease prevention plans and mitigation strategies that they have implemented. We arrange for additional testing if needed for staff or residents. This work is extremely important in preventing the further spread of the virus. Our Lancaster County positivity rate is up slightly from 8.4% yesterday to 8.5% today. The state rate has dropped from 15.7% yesterday to 15.2%, and the national rate remains at 15.7%. Yesterday, Bryan and CHI Health St. Elizabeth completed about 312 tests at their drive-through sites and hospitals. These sites have ability to do 300 to 500 tests per day. So many days they have the capacity to do more. If you have symptoms of COVID-19, we urge you to get tested now. To get started, you can fill out a risk assessment at chihealth.com or bryanhealth.com or testnebraska.com. Today, our local hospitals report 42 COVID-19 patients in their care. That includes 19 from Lancaster County and 23 from other parts of the state. The number of patients on ventilators is now 13, and that includes 6 from Lancaster County and 7 from other parts of the state.
Thank you, Director Lopez. From the very beginning of this pandemic, a primary focus of our local response has been to ensure the health and safety of our most vulnerable residents. And while this virus can impact any one of us, we know that individuals living in close quarters with others are more susceptible to the spread of COVID-19. Because of this increased risk, we have been especially vigilant about the potential for transmission of the virus within long-term care facilities, including skilled nursing facilities, nursing homes, and assisted living facilities. Nationally, there's been a concerning trend of COVID-19 affecting individuals living in long-term care facilities. And in other areas of Nebraska, we have seen these kinds of facilities hit hard by the virus. Lancaster County has 52 nursing and assisted living facilities that are regulated through the State Department of Health and Human Services, or DHHS. And we want to emphasize how critically important it is that we treat these facilities with special attention and care during the pandemic. Residents of long-term care facilities require frequent interactions with staff, including assistance with personal care, such as feeding, bathing, and dressing. This close interaction and the congregate nature of their environment increases the risk for transmission of COVID-19. Additionally, residents are, of course, often at increased risk for severe complications if they do become infected with the virus due to their age and underlying medical conditions. We want to thank all of Lincoln and Lancaster County's long-term care organizations for the comprehensive and compassionate work that they are doing to protect the health and safety of the clients that they serve. These organizations have had to implement new procedures quickly, while at the same time navigate the heightened concerns of residents and family members who are unable to visit their loved ones. The diligent efforts of these care providers have contributed greatly to the current health and capacity of our hospital systems, a key component of our community's overall resiliency to COVID-19. With that, Director Lopez is going to go into greater detail about the role of our health department has played in partnering with long-term care facilities to respond to the virus.
In early March, the Health Department convened many groups in the community to help lead our preparedness efforts. One of those groups in our healthcare network was long-term care. Collaboration with our older adult care facilities is vital because residents are at heightened risk of serious complications from illness due to the dual threat of age and close living conditions. We have worked closely to ensure that these facilities have the latest information regarding COVID-19. Outbreaks within these congregate residential settings can progress extremely quickly, resulting in a large number of cases in a short period of time, many of which may require transfer to an acute care facility. This surge can further stress our local healthcare systems. The Health Department has continued to meet virtually with leaders of these facilities to review current CDC guidance. A few months ago, our focus was on preparation and implementation of current infectious disease plans. Now that the virus has progressed to community spread, our response has shifted to informing facilities about best practices to potentially care for residents with a suspected or confirmed case of COVID-19. In addition, we have provided guidance to these facilities about the use of personal protective equipment and help them fulfill these PPE requests through our Unified Incident Command. We continue to stay in touch to provide technical assistance and answer any additional questions they may have. If a case of COVID-19 is associated with a long-term care facility, the Health Department's communicable disease team is quickly activated. They contact the facility to provide recommendations and infection control support. The team begins contact tracing to determine the source of the infection and how it may be spreading. They ask questions and collect information to help identify anyone that the resident has been in close contact with. The team then communicates with those close contacts within the management of the facility to ensure isolation and quarantine guidelines are being followed. Guidelines vary depending on the setting and the situation. In the event that a staff member or resident tests positive for COVID-19, our team provides assistance in establishing additional testing at the facility as needed. Really, these facilities are doing what we all should be doing, just on a larger scale and with a more stringent process. That is, supporting good hand hygiene and cough etiquette by residents, visitors, if allowed, and employees, ensuring strict adherence to infection prevention practices with disinfection in their facilities, preventing the introduction of respiratory illness into their community, and working closely with the health department for guidance in response to positive cases. I want to thank the staff at all these facilities for all their tireless work to keep their residents and staff safe and healthy. We will continue to monitor the situation in these environments closely and continue to work together to take the necessary steps to reduce the spread of the virus.
Thank you, Director Lopez. And at this time, I would like to introduce Christy Hinrichs, President and CEO of Tabitha, a nonprofit provider of healthcare services for older adults that was founded and headquartered in Lincoln and serves 28 Nebraska counties. Christy will provide more information about how our long-term care facilities are responding to the presence of COVID-19 in our community. And with that, I hand it over to you, Christy.
Team for the ongoing commitment to communication and collaboration to keeping seniors safe in Lincoln, Nebraska and Lancaster County. It's working. Since we first became aware of the coronavirus, we knew that age and underlying health conditions increase the risks of the virus, both the spread and the recovery. And since our life's work at Tabitha is caring for and about 2,500 seniors every day with 1,000 team members across, as you mentioned, 28 Nebraska counties, Tabitha did not take the facts lightly. So while others closed down, Tabitha and providers like us across Lincoln, Lancaster County, and even Nebraska who support seniors had to gear up. Working from home is not an option when caring for seniors is our work. It is a hands-on career that requires the presence of intuitive and smart, caring and thoughtful, the ability to think on your feet team members. And Tabitha and I think Lincoln and Nebraska are just blessed with caregivers that show up every day to do that. On March 11th, one day before the World Health Organization formally announced that COVID-19 was a pandemic, we had at Tabitha initiated our incident command team. Tabitha and all licensed providers of senior care are required to have at our ready emergency plans in place for things like COVID, things that there is no way to predict when it will come or what it will look like or what its impact might be, but anything that could foreseeably, I would say, cause harm to those that we're entrusted to care for. It would be hard to miss, you mentioned it as well, the horror stories being told across the nation that the impact of coronavirus has had in some senior care facilities. Tabitha and our peers across Nebraska are working tirelessly to be the exception to this news, doing everything in our control to guard seniors and one another from this deadly and invisible virus. And while we're dealing with countless unknowns, we can also be grateful that, in fact, each day we do know more. And so when you know more, you have the ability to do better, right? So we've had the luxury to learn from our peers in other states. Tabitha implemented, and many of our peers as well, very unpopular but necessary actions to ensure safety. Things like no visitors, that came early in our world, no congregating, having daily team members do health screenings. We have been doing twice a day resident key vital sign checking. We're committed to not using agency staff. We've not allowed our team members to hold second jobs during this period of unknown and serious crisis. So we've been early and fortunate to ready plans. As Pat mentioned, we've been working very collaboratively with the public department and also with the hospital leaders and other supportive agencies for seniors in the community. Tabitha had the capacity and ability to ready a COVID unit in the case that the hospitals would become overwhelmed or have a surge. We've been fortunate that we've not needed to implement it. Our hospitals have done a wonderful job of having sufficient capacity. That's been a blessing for all of us. Tabitha, because we are a full continuum and have the ability to provide other services and supports for seniors like home health care or hospice, Meals on Wheels, et cetera. We also stepped forward and offered to be a tier 2 solution so that seniors who are able to stay in their own homes or maybe recovering could utilize the support from our home health care team members who are trained and qualified to help prevent spread and help people recover from this kind of a virus. We've been working closely with the Area Agency on Aging, which has been wonderful, as we know that some seniors have certainly experienced food insecurities and other concerns. We know that fear and loneliness is real. So we've appreciated the opportunity to expand our Meals on Wheels to those who are now isolated in their own homes and do that collaboratively with the city. We have been working with senior providers in assisted living, long-term care, our associations that advocate for us, independent livings, seniors in their own homes, knowing that in each circumstance, the needs are different, but that in every circumstance, we're all committed, as Pat said, as you said, Mayor, to just ensuring that we're taking seriously our role to protect seniors. And just can't thank you enough. It has been a long time, it seems, for everyone. I have no doubt, and it's not been easy, and it's not going to get easy probably anytime soon. But I think I can speak for Tabitha and my peers in long-term care that we're committed to stay steadfast to protecting seniors. We need your help. The mayor has been great about reminding people the importance of mask wearing and good hygiene. We can do our best work to protect seniors from the virus when each of us takes seriously that responsibility. So I would say the more seriously each of us take it, the more that we can protect one another, and the sooner that we can reunite seniors with their loved ones. We know that their desire to be together is real, and our desire for them to be together is also as real. But we need 3 things. We need testing, as Pat mentioned. We need proper protective equipment sufficient for us to be able to use it longstanding and in large measures. And we need compliance with protective measures that we've talked about. So with that, I guess my final plea is just please wear your masks, practice good hygiene.
Thank you so much, Christy. Thank you so much for everything that you're doing, the peers and long-term care facilities are doing to protect the health and safety of our seniors and those at greatest risk of experiencing those severe complications and effects of COVID-19. And you know, we want to say thank you to the families of folks who have their loved ones in your care. We know how difficult it is to follow the new rules about not visiting and to really be able to visit only through the glass. And we know that's just incredibly challenging, but it is an expression of love for all of the folks that are entrusted to your care. And, you know, we want to send our love to the folks who you're taking care of too. Our city is thinking about each and every one of them as they spend more time in isolation, yet clearly in such thoughtful and compassionate care. Thank you, and we're thinking of all of them too. And now we have an update on our city operations related to our budget. Sales tax receipts for March are in, and as anticipated, they are down substantially due to the pandemic. These new actual receipts show a 4% loss over March of last year. We are well aware that our community's effort to stifle the spread of COVID-19 really were just ramping up towards the end of March. In other words, we expect that our April sales tax receipts will be even lower. And given all of that, we of course continue to prepare a balanced budget that we will bring forward and recommend to the City Council later this year, one that anticipates changes in our operations necessary to adjust to these anticipated revenue shortfalls. And finally, we'll turn to some good news. While we are unable to celebrate graduations with traditional pomp and circumstance this year, Lincoln Public Schools has come up with a unique way to honor this year's high school graduates, which includes my oldest daughter, Evelina. Along with LPS, we encourage everyone in Lincoln to step outside on Sunday, May 24th at exactly 8:20 p.m. or 2020 in military time, and cheer for this year's graduates as they take their next steps into the future. We look forward to seeing the many creative ways that families and neighborhoods will find to join in the citywide salute. And together, and I'm sorry this is hard for me, there are a lot of things that are hard about this pandemic, but the ones that hit home can sometimes be the most difficult. And as a mom, this one's mine. But together, our community can tell the class of 2020 how much we appreciate their selfless sacrifice and how proud we are of them for this lifetime achievement. So together, let's make this a special and historic day for the class of 2020, one that they will never forget and that we will always treasure. And with that, I'd like to open it up for questions.
Riley Johnson from the Journal Star with a question for Director Lopez.
Right.
Good afternoon, Riley.
Good afternoon, Pat. Could you give us some of the more information on the latest death? Was it a known case? Were they hospitalized, and did they have an underlying condition?
Yes, Riley, it was a known case, and they absolutely had underlying health conditions. And I will tell you, the age range for those who have succumbed to COVID-19 is really an age range from the late 50s to the late 80s. And they have all had very serious underlying health conditions. And all but one of them were hospitalized, and one was close to hospitalization when they succumbed.
I know you spoke about the meatpacking outbreaks earlier, but with today's focus on the long-term care efforts, has there been any cases of individuals in long-term care facilities in the county acquiring COVID-19?
Yes, there have been. Most recently, a very small number. I think we're actually at 12 today.
12 total cases.
Yes.
And are they spread across different facilities?
Yes, they are. And the facilities have, I think as Christy Heinrichs mentioned, the facilities have really been well prepared in this process, and we've established really close working relationships with them. And to their credit and the work that we're doing together, we've been able to minimize the impact across the facility. We also use the ICAP team from the state and the Global Center to come in and assist as needed. We've been able to provide testing directly in the facilities as needed, and overall it's been a tremendous response by the management and all the staff.
Have any of those cases reached a point where they would be considered a cluster in public health terms?
No.
And have any been fatal cases?
Yes.
Several or?
We have had 3. We have to remember to, in our discussion today and talking, and I think Christy could talk about this too, that these are individuals, these residents who have really critical health needs in addition to their age.
Pat, this is Bill with 1011. I was hoping to get your thoughts on antibody testing and whether the city is tracking any of that data or the impact that it could have in the near future.
You know, Bill, I'm sure you've seen there's a lot of different information out on antibody testing. And we've been working closely with Nebraska Medicine in looking at some of the studies that they're doing with COVAX in New York regarding antibody testing. So we're monitoring that closely. We see some new signs that are coming forward, and we're going to provide some additional education in our medical community about what the latest information is related to the antibody testing. We're still working to have some reliable, valid testing done. And then knowing what does that mean related to the testing. If we find the antibody, is there a long-term immunity, and going forward from there.
Is what's happening if somebody does come forward, a Lincoln resident that has a positive antibody test that happened from mid-March or mid-April, is that being tracked or added to the data, or have you not seen much of that?
We haven't seen that. We have people that have perhaps another type of serum globulin test, but then they actually have to have a COVID-19 test to confirm that. So we haven't had results from really antibody testing reported to us here.
Any other questions from the media?
Mayor, I have a quick one. Has there been any discussions between you, the city, and Lincoln Public Schools about the possible use of LPS facilities for youth baseball and softball this summer?
I haven't had any of those discussions, Bill. I can check and see if Parks and Rec has been in discussion, and it sounds like maybe Director Lopez has some insight into that topic.
Great timing, Bill. We're just yesterday had the day before a Zoom call and talking with both Parks and Rec, Health, and the facilities at Lincoln Public Schools. So we're working through some of that process and some of the guidance that's been developed and how that'll go forward. So I can't really say what that is, and I don't want to really, I don't think it's my place to speak for the schools, but just know that we are in discussions about that. And of course, the concern is to do it as safely as possible and in the best way.
Thank you.
Director Lopez, before you leave the podium, just want to follow up to the earlier questions. It is the fact that you haven't had any sort of quote unquote outbreaks at the long-term care facilities the reason why those have not been sort of mentioned in your briefings about the cases being reported daily and whatnot?
Right. And the numbers have been so small, and really, Riley, we haven't had any cases in long-term care facilities before the last week and a half.
And when excuse me, just a follow-up question. Is the health department, do you have a sort of I think Christy had talked about not having to rely on agency staff. Is that the health department that she was referring to, or is there a health department role in sort of infection control at a facility if there is an outbreak?
We work with the infection control staff at the facility. We review their plan and make additional changes. I think, I don't want to speak for Christy, but we've had multiple discussions about this. And what she's talking about is in order to fill staffing needs, I think many of you are familiar where they bring in staff at the hospital when they have a nursing shortage. And it's the same thing in a long-term care facility. When they have staffing shortages, they may contact an agency and bring staff in.
Thank you.
And that's something they're not doing at this time. That's what Christy was talking about.
Any further questions for Director Lopez or Christy? Okay. Thank you so much for tuning in to this community briefing. We'll be back again tomorrow at 3:30. In the meantime, please continue to take good care and stay home as much as possible. Stay healthy and stay connected.